Hello friends, welcome to Midlife. Today we will be studying about cubital fossa. So it is a triangular hollow situated on the front of the elbow and it is bounded laterally by the medial border of brachioradialis, medially by the lateral border of pronator teres muscle, and its base is directed upwards and is represented by the imaginary line joining the front of two epicondyles of the humerus, and its apex is directed downwards and it is formed by the area where brachioradialis crosses the pronator teres muscle. Let's see the boundaries of the right cubital fossa figure. So this is the lateral aspect and this is the medial aspect, and the cubital fossa is a triangular hollow situated on the front of the elbow, and it is homologous to the with the popliteal fossa of the lower limb situated on the back of the knee. So it is bounded laterally by the medial border of brachioradialis muscle and medially by the lateral border of pronator teres muscle. Its base is directed upwards and it is represented by the imaginary line joining the front of two epicondyles of the humerus. Now its apex, it is directed downwards and it is formed by the area where brachioradialis muscle crosses the pronator teres. Now let's talk about the roof of the cubital fossa. So the roof of the cubital fossa is formed by skin, superficial fascia, deep fascia and bicipital aponeurosis. The superficial fascia contains median cubital vein joining the cephalic and basilic veins, lateral cutaneous nerve of forearm along cephalic vein, and medial cutaneous nerve of forearm along basilic vein. Now let's see the figure of structures in the roof of the right cubital fossa. So this is the roof of the cubital fossa, and the roof of the cubital fossa is formed by skin, superficial fascia, deep fascia and bicipital aponeurosis. So the superficial fascia contains median cubital vein joining the cephalic and basilic vein, and lateral cutaneous nerve of forearm which is along the cephalic vein, and medial cutaneous nerve of forearm which is along the basilic vein. The floor of the cubital fossa is formed by brachialis and supinator muscle. The supinator muscle surrounds the upper part of the radius. Here we can see the figure of floor of the cubital fossa, which is formed by two muscles, that is brachialis and supinator muscle. Number A is the surface view, whereas number B is the cross-sectional view. So here the floor of the cubital fossa is formed by brachialis muscle and supinator muscle. The supinator muscle surrounds the upper part of the radius. Now let's talk about the contents of the cubital fossa. We can remember the contents of the cubital fossa by using the mnemonics such as mbbr, which is from the medial to lateral aspect. So from M it is median nerve, from B it is brachial artery, from another B it is biceps brachii, and from R it is radial nerve. So first let's talk about median nerve. It gives three branches, that is flexor carpi radialis, flexor digitorum superficialis and palmaris longus. The median nerve leaves the fossa by passing between two heads of pronator teres muscle. Number 2, brachial artery. The termination of brachial artery and the beginning of radial and ulnar artery lie in the fossa. The radial artery is smaller and more superficial than the ulnar artery. Number 3. Biceps brachii. The tendons of biceps brachii and bicipital aponeurosis. Number 4. Radial nerve. It gives off posterior interossseous nerve, which is also known as the deep branch of radial nerve. It gives branches to extensor carpi radialis brevis and supinator. The radial nerve leaves fossa by piercing the supinator muscle. Now let's see the contents of the right cubital fossa. So the contents are median nerve, brachial artery, biceps brachii and radial nerve. Here are the two muscles which are brachioradialis on the lateral aspect and pronator teres which is on the medial aspect. And here is the bicipital aponeurosis. Let's see the contents of the cubital fossa in a cross-sectional view. So, the contents of the cubital fossa are median nerve and the brachial artery here is divided into the radial artery and ulnar artery. Next one is the biceps brachii, tendons and bursa, and then the radial nerve. The radial nerve gives off branch known as posterior interosseous nerve, which pierces the supinator muscle. And here the median nerve leaves the fossa by passing between the two heads of pronator teres muscle. The brachioradialis muscle lies on the lateral aspect of the fossa, whereas the pronator teres muscle lies on the medial aspect. And the floor of the cubital fossa muscles are supinator and brachialis. The supinator muscle surrounds the radius in its uppermost part. See its clinical anatomy. So the cubital region is important for the following reasons. Number 1. Median cubital vein, the vein of choice for intravenous injections. Number 2. Brachial artery. The blood pressure is universally recorded by auscultating the brachial artery in front of the elbow. So here we finished about the cubital fossa. Please like, share and subscribe for more videos on anatomy. Thank you.